This is just one more village of Uttar Pradesh, whose women are lost in the mists of male-dominated tradition. Invisible, they labor and perish, bearing countless children, many of which never survive, within impenetrable walls of ignorance and silence. But today, you hear an incongruous but welcome note and voices colored with hope and care. Village women in the Sitapur and Shahjahanpur districts of Uttar Pradesh today enthusiastically enact this play, demonstrating among other things the downside of trusting witch doctors. But not long ago, to get to them on health issues, CARE had to break several barriers of poverty, superstition and lack of awareness about health in general and which the community organizer checks periodically. Every month, animators from different villages collectively report to the community organizer.
In each block, 2 community organizers who supervise the animators. And at the district level, we have the field officers and then finally the project officer who supervise the community organizers and also liaison with the government officials.
The women's meetings and related activities are closely coordinated with the Anganwadi workers or AWWs and the ANM, and usually in cooperation with the local NGO. The AWWs and the traditional birth attendants or TBAs also actively participate in the meetings. Now, the traditional roles of the ICDS and the Public Health Department of the government overseeing health and nutrition and immunization converge with community participation. As a team, they provide basic reproductive health services, education and information to the villages.
आंगनवाड़ी सहायिका ग्रुप लीडर ये जो
Anganwadi workers, group leaders, animators. They bring the women together in one place and that makes our work easy.
बड़ी सुविधा हुई है हमको.
Health camps headed by the medical officer in charge further support their activities from time to time. There are also special camps only focusing on obstetric checkups for expectant mothers. Another kind of support is the training workshops CARE organizes for the various players in the health service chain. Animator, Anganwadi workers, ANMs, TBAs, medical officers and other health workers. This makes for much needed synchronization in the content and method of their approaches. Although dye kits are distributed free, in some blocks TBAs socially market them on an experimental basis. Along with the AWWs, ANMs and medics, they carry health messages to non-project villages as well. Those doing IEC of any sort use tools designed by CARE and other agencies to communicate effectively.
Cards, flip charts and such things. What we can explain so well with the help of pictures is not so easy if we just explain verbally.
It is not just women, but also the male groups formed by the Community Health Guide who are becoming more aware. They learn all about women's reproductive health and their own, including the use of condoms, and about STD, RTI and HIV.
The women of the groups knew all about their bodies, but the men would say this is all nonsense.
Before, the men wouldn't allow their women to get treated.
Ever since the men and women have begun their meetings, our work has become very successful.
Some villages have begun a trend of creating a special obstetric fund for their pregnant women and organizing a vehicle pool for a quicker transfer to a hospital in case of danger signals.
If delays happen, in a risky case, the mother or child can die. You need money to prevent this.
We have a fund for quickly transferring the pregnant women of our village to a hospital if needed.
Many groups, both male and female, have formed self-help groups for small savings to deal with financial contingencies, mainly relating to health. Their pride in the program is to be seen all over the village walls, in their art, in their plays, in their songs, their own initiative in spreading the good word. The changes have benefited different people in different ways.
The villages and women benefited, and they have facilitated our program implementation.
The hospital was far. Some would go, some wouldn't. Now the A&M comes right here and gives medicines and vaccinations.
This program has made a lot of difference. The women won't talk of RTIs and STDs even to their families. Now they tell us everything.
We couldn't get birth and death figures. Now the animator gives them to us.
Now there's more exposure and awareness among people.
Before, the women would use a dirty cloth for their menstruation. Now we teach them to wash and sun dry it before use.
We used to squeeze out the mother's first milk. Now we clean the breast and feed the baby like they tell us to.
I have 4 children. Since the meetings, I have been using contraceptives. I know all about the pills, copper tea, condoms, and now I expect I won't have a 5th child.
The CARE project has done what the government programs were unable to do.
They told us about the newborns care and the 5 cleans.
The babies used to always get ill, but after my training they don't. They're healthy.
They respect me more after I got trained. When a woman gets pregnant, they call me to check her up.
Training gives progress and new learning, which we share with the women in the villages.
From health, the benefits have spread to other issues of interest. A trained animator with a mobilized community is a ready platform to piggyback other development programs on, like the literacy mission.
It's not only literacy mission, it's also all the national programs, like when we have the TT campaigns, or we have the pulse polio immunization rounds, or the leprosy programs, programs related to HIV/AIDS.
While some groups are still joining hands, for the older ones, it is harvest time. While some have organized training in tailoring, stitching, poultry and fishing, for others, a good catch is community concerns like hand pumps, roads and schools. They are learning to exploit collective strength by coming together for the health groups.
In some blocks, they've started schools, and like almost every month we have something new coming up.
But the most significant transformation the project has brought is in their behavior. From being cajoled and forced to accept health services, today they value it and demand it as their right. CARE has run the project in 14 blocks, covering 1,433 villages of Uttar Pradesh's most backward areas. There are countless more to reach, and much remains to be done in the project villages themselves, where the people are awakening to new possibilities.
Our girls want a separate group for adolescents so that they can learn about their reproductive health.
Once I've conducted the delivery, I don't know how to handle postnatal complications. If I get another training, I'll know about that too.
Working with over 8,000 grassroots workers for a common purpose, CARE has catalyzed a convergence between health, ICDS and other development programs with active community participation. It has reaped a story of success that can be replicated by anybody, anywhere in rural India. Its voice is being heard past oppressive walls to open up windows of new awareness, and still it must reach out to so many more to empower the rural woman to take charge of her today and create for herself and her child a healthier tomorrow.